welcome back. I'm talking about inventions just as we were talking in the very beginning, something that is very important to be creative, thinking out of the box, and this is exactly what we need nowadays to build our new Egypt. Today we have a very important invention actually that has to do with the treatment of epilepsy. Today we have the pleasure to have with us Dr. Ahmed Abdelaziz. He is a consultant surgery actually from الحواري hospital, and he has a very important invention. We are going to bring you more details about it. First of all, good morning and welcome, doctor.
Good morning.
Good morning, doctor.
Good
Can you
morning.
please introduce yourself more and tell us more about your invention?
Yes, well, in the name of Allah, the most gracious, the most merciful, and prayers and peace upon our Prophet Muhammad, I started this talk with you. I would like to give just an introduction definition of epilepsy, and then we will progress to the pictures which we will need.
Yes.
Epilepsy, actually, I just give a simple, not complicated medical definitions. Epilepsy is a recurrent fits, recurrent attacks of fits. So it must be recurrent to make it, or to call epilepsy. It is must be recurrent fits of epilepsy. So if we have a patient, for example, has febrile, I mean hyperpyrexia, temperature above 40, he can get fits, but it is convulsions, and it's called febrile convulsions, but not epilepsy. If it is recurrent, so we speak about epilepsy. Epilepsy is an old and chronic disease since old ages, and some of the Greek caught this disease. For example, Alexander, Beethoven, Napoleon Bonaparte, Herakl, and Isaac Newton, many of the Greek this disease. So we start this by a case which we have, and actually the medications are not so effective, so we think of this invention. That's just I would like to give.
Can you tell us more about this device? What does it exactly do?
Yes. This device
and I'm sorry, but can you raise your voice, please? I'm very sorry.
Actually, this device just has a modification of the epileptic focus which is present in the brain. As just we told before, that epilepsy is a recurrent attacks of fits due to active epileptogenic focus in the brain. This epileptogenic focus may be due to trauma to the head, or due to inflammation, meningitis, for example, meningoencephalitis, and other causes. So the focus is present in the brain, and this device just to do modification of this abnormal electric discharge of this focus to different parts of the brain. So this is very important, because the focus discharge, but irregularly, number one. Number two, the discharge, the electricity, pass in different ways, not in the normal ways. So according to the centers which it catch, if it goes to the motor area in the brain, so we have different contractions of the muscles. If it goes to the sensory areas, the patient may feel abnormal alarming signs, hallucinations, maybe auditory hallucinations or visual hallucinations.
Yes.
Also, if it goes to the visceral areas, the control of urination, the patient may urinate. So the presentation of epilepsy is different from a case to another, and according to the discharge and the areas which are caught by this abnormal electric discharge from the focus. So the device is, what is the function of the device is to do modification of this electric focus.
So, Dr. Ahmed, of course, we have photos for your invention, and now we are going to watch the first photo. So, can you tell us, please, more about the first photo?
So the first and the second, I just classify our photos to make a complete, comprehensive view, and in short. For first and second photo, the first and second photo is for a case of epilepsy and what is done as the first aid for epilepsy. A case of epilepsy, so the most important thing in epilepsy is to keep airway patent. To keep airway patent. Again, I repeat, to keep airway patent, this means that the head, the neck must be extended and let the patient on one side and somewhat tilted to the front. So why tilted to the front and on the side? To prevent the tongue from retraction backwards. So if the tongue is retracted backwards, if on his back, the tongue will retract it backwards and obstruct the airway. If the neck is flexed, then we obstruct the airway. So these two conditions must be present. Number one, on his the neck is extended, and number two, the patient is on her side, one side, left or right side, and somewhat tilted to the front. So you keep the airway patent and keep the tongue from injury, biting by the teeth. This is the most important. So we have in the first and second picture cases of epilepsy and what is done for it.
So, okay.
Second case then we have cases actually of epilepsy. These cases for the children, and actually we have tonic and chronic convulsions. You will see the patient is arched back because of the severity of contractions of the tonic type, and also the patient, another type is called colonic contractions, but it is less severe, and in this case is just a presentation for cases of epilepsy. The cases of epilepsy may be grand mal epilepsy or petit mal epilepsy. This is clinical classification of epilepsy. We don't want to go in details about this.
Doctor, is it available right now, this device, to anyone who wants to use, or where are we now when it comes to the invention as a whole? Now, as we understood, it is finished and anyone can use it, or you finished with the tests, you finished with everything.
Right.
So where are we now? How far can people use it and reach it?
Yes, it is a very good question, because this is the fate of many inventions in Egypt and many of the master and the doctorate
I don't want it to be in the desk.
Yes, in the drawers of the desks and the shelves of the libraries in different universities. I see myself these cases. But here the case is our case, and we start with it. Because of there is no improvement of medications, we have started the idea and application, also clinical application. And there are cases managed actually, and we can classify the cases into three categories. The first is complete response, and they can do without medications. The second class, partially by the device and with medications. The third didn't respond because the focus is deep and in other areas. So it is different, and we need more and more response, because I have done it. We work outside, abroad, in different fairs, and here, but the response is very, very, very slow.
But Dr. Ahmed, what made you think of this invention? Why did you think of this invention, especially that you are specialized in a maybe different medical branch?
Yes. I am a surgeon, so I am away. But the problem is that my relative, my daughter actually, enforces me to The need is the mother of invention. We know this.
Yes.
The need is the mother of invention. And actually, there is no drawbacks of this. I would like to the fifth picture, surgical operation for epilepsy. They try this, but the problem is that complications are more and more. Here we deal with a device of no complications because it is used outside the body on the frontal area here on the front, and there is no drawbacks or complications. But multiplication means satisfaction of none. There is no idea born complete. This is well known. We know the telephone started, and now we are in the age of communications. And also aeroplanes, like many animals. It is very important to stress on that this in need of more and more ideas to and applications to make this invention practical. We try it with many cases, but we are in need of an hospital, and at the same time tries and to classify the patients, which cases are responding to this, which cases didn't respond. So we are in need of more and more trials. I think there is another picture of patent. We will speak later on.
I think this is something very, very important because just as you mentioned, you are trying to find a solution for a
Yes.
problem that you are living.
Definitely.
You are not waiting for someone to provide you. And I think this is important. If all of us, we can work on this and do it, definitely we will have some new ideas coming out of scratch.
I have been suffering.
Yes.
I myself, I have been suffering actually, because once this, and my brother, Engineer Adel Abdelaziz, is present here now, is the unknown soldier behind this invention, because I have the medical supervision and he has engineering or design supervision. So he is the one who is responsible actually for design of this device, and I myself have the responsibility of supervision. So we will write notes, and so day and night since more than 10 years. We started this before registration of this patent.
Invent, yes.
Yes.
So-
It is very important that the attack squeeze the patient. The attack squeezes the patient, so the patient after this go into deep sleep because it's very fatigued.
So actually, doctor, as we're running out of time, and of course we need more time to discuss maybe the side effects and the cost and other things, so it might be in a later episode. Dear viewers, as we are running out of time and we are wrapping our episode, we would like to thank our dear guest, Dr. Ahmed Abdelaziz, consultant surgery at Al Hawandiyah Hospital. Doctor, thank you very much for joining us here.
Thank you. Welcome.
Thank you.
Welcome.
Thank you very much.
Welcome.
And with this, we come to the end of our breakfast show. And let me also tell you, this is a very special episode. We are enjoying this beautiful weather in Egypt. To anyone who is interested just to spend a vacation, just as you can see here during this beautiful period of time, the weather is moderate, beautiful, the sun. You will enjoy many different things. So that was all for now. Thank you all for joining us. And stay tuned for more coming up on Nile TV International.